Welcome back to the show, Talk with Your Doc. With me is Dr. Kushal Dighe, and we are talking about coronary artery disease. In the previous half, we talked about various investigation methods, including angiography, and then we were talking about angioplasty. And you mentioned that after angioplasty, one has to take aspirin and other medications for as long as it is prescribed.
Right.
So, other than the angioplasty, what are the other procedures which are done to treat the coronary artery disease?
So the other procedure is coronary bypass surgery.
Coronary artery bypass graft surgery.
That's right.
Yes.
So it depends on the angiogram typically. So if the angiogram suggests that the patient has extensive coronary disease, meaning long segments of narrowings or heavy calcification, or in all three vessels, or in the left main coronary artery. So the more complicated the coronary disease is, the more benefit the patient would derive from coronary bypass surgery as opposed to coronary angioplasty.
Okay, so coronary artery bypass surgery is selected when there is a severe disease probably, and the heart is functioning nicely or heart is viable, then you do the cardiac bypass surgery. Now, for the bypass surgery, is there any age limit, like younger patients more respond to bypass and older patient doesn't respond or something?
No,
like that?
nothing like that.
So anybody can.
So as long as what they assess is the patient's risk of bypass surgery as well, because it's an open heart surgery, it has its own risk factors, or so there is an assessment of every patient as, is this patient's risk too high, and if so, are there any modalities that we can do to revascularize this patient, i.e. coronary angioplasty. If the risk of bypass surgery is not that high and the benefit is quite a lot, then preferably the patient should go for coronary bypass surgery.
So when you use this graft for this bypass surgery, what material is used for the grafting?
Typically it's your own arteries and your own veins.
Okay. So it's your own artery from the chest, or the thigh is used, or leg muscle is used?
No, so it's the arteries from inside the thorax or the chest, and the veins from the leg.
Right. So these are arterial grafts and venous grafts.
That's right.
So which one is where to be selected, or can you tell the doctor that I want to go for arterial graft or venous graft, or how do you do that?
Typically nowadays the arterial grafts are better, they're long laster than the venous grafts.
Right.
But then again, you have to assess. It's not like when the surgeon assesses the patient, for example, if the arterial graft is very small in caliber or is already damaged, then they cannot use the arterial graft. So it is a matter of what is available as well.
So venous graft has more chances of reblockage or restenosis?
That's right. Compared to arterial grafts, the venous grafts they don't last as long as the arterial grafts do.
Right. So how is the life after the reconstructive surgery?
So after bypass surgery, it's a big procedure. So typically this is again in the bigger hospitals. Not all hospitals will have the facility for coronary bypass surgery. The recovery period is longer. It again depends on the patient's age and comorbidities. Typically they take at least 4-6 weeks to recover from this procedure.
Right. So once the bypass surgery is done, the graft surgery is done, do you have to take any medications for the lifelong?
You have to typically be on same medications as you would typically go with angioplasty as well. So doing angioplasty or doing coronary bypass surgery doesn't mean that we have cured you. You still have the risk of either narrowings in your own arteries or narrowings in the bypass grafts or narrowings in the stents. So you still have to be on medical therapy irrespective of the modality of revascularization.
Right. And so you need a lifestyle modification changes following the surgery as well?
Yeah, so typically all patients after angioplasty or bypass surgery will be enrolled or should be enrolled in a cardiac rehabilitation program where they assess their cardiac risk factors or modify their cardiac risk factors or alter or change or like adjust their cardiac medications based on the needs of the patient. So it's not like once it's done, you're all fixed and you can go home and carry on with the bad lifestyle.
Right. So modifying the lifestyle, healthy lifestyle, healthy eating,
Sure.
exercise, no smoking,
Absolutely.
moving around, no sedentary lifestyle.
Absolutely.
All these are required modifications so that restenosis doesn't happen, and you can
or restenosis or having atherosclerosis in your other arteries.
Correct.
Right. So you're not replacing these arteries.
Correct.
You're just treating the problem, and you still have the risk of having blockages in other arteries in your heart.
Now, one more thing is prevention aspect, going back to if somebody's family history is positive for coronary artery disease, say my father has a coronary artery disease, what precautions I should be taking? Is there any non-invasive, I was reading about CT angiogram procedure, which
So
is recommended?
Again, if you have symptoms,
Mm-hmm.
then yes. If the patient has no symptoms, you can't have a screening test.
No screening test available.
No, you shouldn't be screening people just because you have risk factors. No,
Mhm.
you can do based on the risk factors. You can do a simple screening test like an exercise stress test. But if you really have symptoms, then you should go for more invasive testing or the test is because some of these will give you some radiation and so on as well. So they are all not that benign procedure tests.
So we should have healthy lifestyle, and then whenever you have symptoms, you get
Absolutely.
the investigations done.
Absolutely.
Thank you, Dr. Dighe. It was really useful for all the 2 weeks you were here and help us to know about the various heart disease signs, symptoms, investigations, and treatment options.
My pleasure.
We really appreciate it. Thank you very much.
Thank you.